So we are going to identify structure of the respiratory system. It is actually not everything. There should be nose, nasal cavity, nasopharynx, and then oropharynx. After that, let's start from here. This is the larynx. And larynx has 9 cartilages. 3 of them are unpaired, 3 are paired. Those unpaired cartilages will be the thyroid cartilage, just like this, looks like a butterfly, and then cricoid cartilage, and the third one is here, the epiglottis. So when we swallow any food, this epiglottis is going to close this and making the food go to the esophagus and back of the larynx. So this is epiglottis, thyroid cartilage, and cricoid cartilage. 3 unpaired. There are 3 more paired cartilages, which is difficult to find in this specimen. Which, they are cricoid, corniculate, cuneiform, and the arytenoid. This is the epiglottis, epiglottis cartilage. That one. Vocal cord, it is the false one. This is the actual, true vocal cord that makes the sound. And we see the cartilages, C-shaped cartilages are here. And now this trachea will enter into our chest. Well, branch into the last part of the trachea is called carina. It has 2 branches, right and left bronchi, and they are the primary bronchus. They will separate into secondary one, and then when it comes here, the secondary one will become tertiary bronchi. You see that white color things. The red one, these are the pulmonary veins, because the pulmonary vein is oxygenated part. Then we have those dark colored pulmonary artery, and all these things are entering through this area called hilum. They are entering or exiting. What we see here, the dark colored, this is the pulmonary artery. This is the arterioles, small arteries, pulmonary venules, small veins. Those white things are the bronchioles. And all the small dots here you see, these are the alveolar sac. The gas exchange happening. Structure D, you see, that's the esophagus. Number 10 is the descending aorta. It comes from the ascending aorta, arch of aorta. And you can see here, this esophagus is coming out because there lies the stomach, which is not shown here. On the right side, there will be big structure called liver, right? And this thin muscle, thin but very strong, it is the diaphragm. Aorta, descending aorta, this one. So diaphragm helps us to breathe. The difference between right lung and left lung. Right lung is bigger because it does not have any cardiac notch like this. Left lung is smaller because it has some space. It has to compensate for the heart to accommodate it. Right lung has 3 lobes, superior, middle, inferior lobes. Left one has 2. So remember the difference. Though it is larger, but it is shorter because the liver is going to push it upwards. That is why it looks a little bit shorter than in comparison to the long one. I believe I have covered everything. This area is called mediastinum, and you see the shape is almost like the heart. It has to accommodate this heart. Fissure. This is the horizontal fissure. This is right oblique fissure. This is left oblique fissure. And